You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. In this episode, Point of Care Partners business strategist Brian Dwyer takes the host chair for the first time. He's joined by Sam Schifman, Principal Engineer for AI at Red Hat and a consultant here at POCP, alongside Kendra Obrist, Senior Consultant and Payer Interoperability Subject Matter Expert here at Point of Care Partners. Together, they discuss what healthcare executives should consider as they evaluate AI, from understanding risks to asking better questions of vendors and internal teams. We hope you find this episode helpful. If you have topic ideas for future episodes, please reach out to us at www.pocp.com.
Hello, and welcome to The Dish on Health IT. My name is Brian Dwyer. I'm the Business Strategy Lead at Point of Care Partners, and I'll be your host for today's episode. If you spent more than about 5 minutes reading healthcare news lately, you've probably noticed AI is simultaneously being hailed as the answer to everything and questioned as the next shiny object. So somewhere in between those extremes is where today's conversation lives. Rather than trying to predict the future, we're taking a snapshot of where AI stands in healthcare today. We'll explore where organizations are seeing measurable impact, where implementation is proving more difficult than expected, what business leaders and technologists should be paying attention to, and how emerging policy may shape what's next. Things are changing incredibly fast. None of us has all the answers, but thankfully our guests spend a lot of time following these developments. So hopefully we can save you a little time separating the signal from the noise. So let me introduce my colleagues. Joining me today, Kendra Obrist and Sam Schifman. Why don't the two of you introduce yourselves and tell us how you came to your current roles and how you've been staying up to speed on AI and its adoption in healthcare?
I'll go ahead and start, Brian. Thank you. Good morning, everybody. I'm Kendra Obrist, a senior consultant and the payer practice lead with Point of Care Partners. I've spent roughly the last 35 years working in healthcare, solving business problems with technology, most of that time in the payer-provider interaction space. AI is the newest and most powerful tool, certainly in my technology toolkit and most likely in yours. Staying up to speed, however, with AI feels like a full-time job. Moves really, really fast, and I think staying up with it might be nearly impossible. I read a lot, attend sessions on how it's used in healthcare. Spend a lot of time talking to our customers, both payers and technology vendors, understanding how they're using and thinking about AI, and really, actively work to incorporate AI into my own life, both personally and professionally, so I can experience it and experiment with it to better understand the power sort of firsthand. Sam?
Thank you, Kendra. Yeah, Sam Schifman. I've been a software architect for like 30 years now across a number of different industries. The last, I want to say, 6-7 years in healthcare IT, focusing on interoperability, particularly how to make data into a useful asset in healthcare, which is an interesting challenge. Most recently, I've joined Red Hat as a principal engineer for AI. And that's, that reflects across my career and interest in AI. Back when I was working on HR software, I wanted to use sentiment analysis in order to figure out if managers were giving a rating that actually matched up to the descriptions that they were giving, the comments they were giving about employees. That never came to fruition, but I've been interested in AI throughout my entire career. And, as I got into interoperability and unlocking the power of electronic data, that really, AI became front and center in there. Ended up working a little bit with John Snow Labs and presenting there on how we could use NLP. And this was kind of just at the cusp of when generative AI was exploding. That got me into really looking at retrieval augmented generation, how we could use knowledge graphs to unlock patient data. And now I'm at Red Hat, where we're really talking about how we're going to bring multi-agent systems to the enterprise in a reliable and responsible way, which I'm super excited about. The other really exciting opportunity that I've had is working with point of care partners, engaging with the customers that are constantly looking at these problems, being able to talk to them about the technology choices that they're making, the architectures that they're putting in place, as in part of point of care partner engagements, in a way that's really, really interesting and compelling to how we can solve real problems together. People can certainly check out my YouTube channel, where I've posted a bunch of stuff that I've actually now building with AI. And that's how I keep, I keep myself up to date. Luckily, I'm with a bunch of colleagues who help me keep up to date. I keep up to date that way, but I also keep up to date by keeping my hands in it and using it to do a number of different things.
Well, thank you, Kendra and Sam. That's a very helpful foundation. Let's talk about where AI is actually delivering results. When healthcare organizations say they're using AI, what does that actually mean? What technologies are often being lumped together? Sam, why don't you take the first shot at that?
Somebody I was talking to recently said, you gave me a great definition, which is AI is anything that the computer can't do yet. And everything else is computer science. AI has been thrown around as this kind of mythical solving for everything. It means just about anything. I could actually make an argument that any computer science project, any program that you see out there is AI in one way or another. And it certainly traces its roots back to Alan Turing at the beginning of computing, right? He was already thinking about AI. I think that it's not useful, of course, to have such a broad definition. I tend to think, that the definition that works for me is to think about it as things which are trying to achieve goals that the programmer, the human who built the application, didn't necessarily know about to begin with, right? And that becomes a broad set of possibilities of different things from predictive AI or machine learning, which you hear about. People will throw around that term machine learning, and that is the process of taking a bunch of data and having the computer figure out a model that helps it predict things in the future based on that data, rather than based on, say, a set of rules that a human has told it about what the future should be. So that, you have predictive AI. Now we have generative AI. They come from very much the same place. People generally kind of think of generative AI as being when the AI is used to generate new content, which can turn it then into conversational AI, where the AI is interacting with the person and the interaction leads to other things. And that has now led us to agentic AI, which is the ability to allow the AI to actually do things on your behalf and take action in the world. And these are all really exciting, different sort of meanings of AI. But I think we're just at the cusp of seeing how these things are really going to shift our world.
That's great. Kendra, anything to add?
Yeah, Sam, I agree with you totally. I think about those same sort of categories when I think about AI, and I always sort of laugh when people say, "Oh, well, we're doing AI or we're using AI." Sort of like, well, I'm using my phone. Well, it's like, what are you doing with it? And so I think that's sort of the meaningful conversation is, how people are using AI, either, one or combinations of those categories of AI together to solve real problems.
So if that's where AI is succeeding, why do so many promising projects struggle? Where are you seeing AI create measurable value in healthcare today? And what distinguishes successful implementations from those that fall short?
Yeah, maybe I'll start with that one. I don't think AI projects are that different than other sort of large scale new technology initiatives. They're struggling for the same reasons that technology projects have struggled historically, insufficient planning, thinking that technology can solve the problem all by itself, sort of with no human intervention, not having the right people involved, either before, during, or after the project to support it going forward. AI also carries sort of a set of inherent risks that call for increased oversight, auditability, and governance, which, technology projects have always really called for those. I think AI, because of how new it is and how sort of thinking by itself it is. I don't know how to say that. Sam will have a better word for that than I just used. But I think that makes it, just a little bit, requires a little bit more care than maybe some technology projects that have been done in the past. And I think, outside of personal productivity, where people are making, I think, just great strides in their own sort of, I'll call them personal professional lives or individual professional lives in using AI, the gains today are coming sort of in the administrative realm, certainly in the world that I live in. Documentation, interacting with members and providers if you're a payer, the world of claims and prior authorization. These certainly have the opportunity, and I think are starting to show a real return on investment. And, success is an interesting, is this project successful? I think that largely depends on, how you decided success would be measured when you started. I don't think enough focus is often placed there, sort of deciding, what is it that I'm expecting this project to deliver for my organization? How am I going to measure it? And are these practical? We shouldn't expect AI to perform miracles or to be perfect sort of right out of the gate. So setting those very practical measures and objectives at the beginning, I think, will allow us to have a better sense of whether AI projects or technology projects all across the board are successful or not.
Yeah, I couldn't agree with you more, Kendra. I mean, I think that it's always about setting your goals right. I do think that many of these elements are the traditional elements of any software implementation. AI does kind of take it to the next level with the autonomy that it can have, right? And so I think there is a little bit of a shift that people need to start making. They need to start thinking a little bit more of measuring their AI projects like they would measure employees or corporate projects, rather than thinking about it how they would measure necessarily a software project. So I hear a lot of people want to talk about token count, for example, right? How many tokens am I consuming for this particular project? And I don't think that ends up being as valuable as thinking about it in terms of the KPIs that the project's really going to return for you, right? So thinking really about how you're going to measure your project at a KPI level, at a achieving business goals level, is super important. But then also understanding what the risk profile is, right? There is an increased risk profile with AI. The power of it is that it is generally not going to do exactly the same thing every time that you ask it to do it. And that's going to introduce risk. We always know that we're always in this risk-benefit analysis across any business, but particularly in healthcare, right? There's this risk-benefit analysis. If you took no risk, then you wouldn't accomplish any of the wonderful things we do accomplish in healthcare. But obviously, the risk is really high in healthcare. So understanding your risk-benefit analysis. So how do you measure those KPIs against the risk that you're assuming? And don't pretend that you can mitigate the risk entirely. Because if you're mitigating the risk entirely, quite frankly, you're doing traditional software, and you might as well just go approach this as a traditional software project. So I think that's important. I do agree with you that the areas where we're seeing the most benefit today are in administrative work, but we're also seeing a lot of clinical applications in terms of, again, mostly administrative in terms of like writing notes, right, and things like that. What I'm really excited about is I think we're at the cusp of being able to sort of start talking about how do we go to the next level? How do we actually transform what we're doing rather than just make it more efficient? I was talking with somebody the other day, and they were talking about the transition from steam power to electricity, right? And that interesting transition that happened where with steam power you had a centralized turbine, and then you used a bunch of belts to get the power from that centralized turbine out to wherever you were working, right? And when electricity came in, they tried to do the same thing. They tried to have the centralized turbine. And then at some point, somebody realized, no, with electricity, there's no reason I have to have one centralized turbine. I can put my motors out at the edges, and I can all of a sudden achieve amazingly different things and revitalize my business. And that led to really being able to do factories and conveyor belts and things like that. I think that we're in that same sort of place with AI right now. People are at that, how do I take my steam engine at the center and replace that? Where we're going to see a really interesting thing over the next couple of years is when people start to realize, no, I can really revitalize how I do this work. And that's going to be super exciting.
Very, very interesting. So let's look at the other side of the equation. Why do technically impressive AI solutions often fail to deliver meaningful business outcomes?
Brian, I can start with that one. I think, technology alone really doesn't do anything all by itself. And a lot of people, and business people, all kinds of people, myself included sometimes, are really sort of overly impressed with the sales pitch. It's the sales pitch, it's the slick technology. Brian, you mentioned at the beginning calling it the latest shiny object. I mean, I've seen some AI sales pitches that they sort of leave you there with your jaw hanging open going, wow, that's really cool. But the reality of using AI in business is a lot less cool. You've got to use it. Sam mentioned, that treating it like a person and measuring the value that way and thinking about it, particularly agentic AI as, teams of agents that actually can do work for you. And that's where we're going to get that real benefit. And it's really hard to go from the slick demo to implementing that in real life, which requires, a lot of hard work and planning and adoption and governance and worrying about data quality and managing your business objectives. And that the slick sort of demo doesn't translate well always into the world of reality.
Yeah, I think you're right, Kendra. I think it's people don't start by understanding those fundamentals of the risk profile that they're really looking at. And they leap into this magical, like, okay, yeah, I can use predictive AI to answer all my problems if I just build the right model, right? And people don't understand that there's a risk there, right? When you're building a model using machine learning, you don't always know how that model is being built and what it's going to decide on internally, how it's going to be structured. And we've had some very public cases of people who built machine learning models that they thought were going to be amazing and have turned out to make predictions based on things that they didn't realize, parameters that they didn't understand were part of the model, that ended up with them in bad places, right? I think the solution that people need to think about is, again, understand your risk profile. Where are you going to apply this? What's going to be how are you going to do a review, and how are you going to manage that risk in order to assure that you're able to recover, right? You're able to say, okay, yeah, we used AI here. It made us a little bit more efficient, but we had a human in the loop. We had a person reviewing it, and they were able to make sure that the bad things didn't happen. And being able to document that and talk about that is going to be super important to you as a business, right? So I think that it's also not looking at the human impact, right? And not understanding, so many projects in computers have gone forward without looking at the human impact and understanding what the reality is, right? There's the famous example of Watson Health, right? Which really thought it could solve cancer. And that project, billions of dollars down the tubes. And I think largely because they didn't really think about what the human aspect was and what the incentives really were in the situation. I have a lot of interesting conversations with people today about the implications of AI to their workforce from a burnout point of view. And I think you have to think about that as you're bringing these things into the picture. Yeah, sure. Ambient dictation to notes is helping doctors not have as much burnout. But at the same time, it means that there's a bunch of context switching that's happening for employees. And you need to be aware that those employees are now going to be expected to kick the AI off to do something and then spend their time on something else and come back and forth and context switch in a way they haven't before. So we have to take those things into account as we're rolling these things out.
Great, thank you. I mean, it sounds like there's a fair amount of complexity here, and it's evolving rapidly, and just there's a lot to know. So think about the average healthcare executive, how much does that individual really need to understand about AI in order to make, sound strategic decisions?
Yeah, there's so much hype and so much like AI is amazing and incredibly difficult to understand and so on and so forth. And at some level, there's some math there that's really, not everybody's going to understand that math and get deep into it. But I do think people can build a mental model that's not too far away from the truth, that gives them the ability to really ask intelligent questions, right? I'm excited because Point of Care Partners, we're working together to come out with a little bit of a training around this that we're hopefully going to have out soon. That's going to help an executive understand enough about the problem and build that mental model that they need to ask intelligent questions and not to just assume that it's magic. You really can comprehend what's going on, even if you can't do the math at a low level, at least as well as anybody can. I mean, there is a level of that math that gets beyond anybody, but don't let people tell you that it's just a magic black box that you can't possibly understand. Force them to tell you, to give you at least the mental model of what they're doing and why they're doing it and how they're doing it.
Kendra, anything to add?
I think that's a really great point because I certainly don't understand AI to the level that you do, but I am able, and with some of the help that you've given me over the past year or so, to understand sort of what lays beneath it without necessarily understanding the math, as you said. I think the other thing that's really important for executives to understand is the opportunity that AI is creating for them and their organization. I think it's easy to kind of gloss over it. And unless you experiment with it personally in your own life to understand sort of the types of things that it can do for you, it's really hard to get your head wrapped around the opportunity that it can create in your business. So, I would encourage healthcare executives and the executives or anybody to really just play with it. Have AI do things for you, whether that's planning your vacation or creating a spreadsheet or, God forbid, managing your calendar or your inbox. But try something and ask AI to do that and sort of push it a little bit in areas where you feel sort of safe. And I think it will really open your eyes as to how powerful the technologies really are and how they can be used to solve maybe simple problems like, planning a vacation or really very complex sort of multi-step, multi-agent types of tasks.
Yeah, I think just to add on there, that's a great idea. You using it in your personal life. I've also have talked to several executives who basically made it an initiative for their team that you must use AI to do your work for like a month and force them to kind of force their team to get their hands dirty. And that has had great impact. I know several teams at Red Hat who followed that kind of process and had some great results from it.
Yeah, that's great ideas. So Kendra, you touched on this a little bit, with the vendors. Vendors are making increasingly bold claims around AI, and you mentioned the slick demos that leave your jaw agape. And so think about a healthcare organization that's making investments in AI-enabled solutions. What questions should they be asking the vendors to make the best investment?
Well, certainly there's a lot of sort of high-level questions there that apply across any real scenario. And I hope I didn't offend any software sales people with my comments. I've been one myself, so I don't mean any harm there. But it's easy, especially with something as powerful as AI, to get excited and impress people with it, certainly. But I think, getting down to the basics again of, AI is however powerful it is really just another technology tool that should be evaluated in much the same way. What problem does it solve? How's success measured? What are the risks involved? What type of data do you need? How are behaviors and decisions that are made by the AI tools audited and monitored, and how is quality assured there? How can you use AI to sort of help manage accountability? And then I think, understanding how they view the role that the vendor as an organization plays, I'll call it when things go wrong. So if something happens, do they have any accountability for that? They're providing you with a technology that certainly as an implementer, you have a huge obligation to do all the right things. But if the basic technology fails you, AI, even faster than other sort of worlds of computer technology, can do a lot of wrong things fast. And if the technology fails you, then, and I think you need to understand, how your vendor is going to support you in that.
Yeah, I mean, I think you're right in that we're, again, reiterating this kind of theme that it's not that different than the other software things that you have, software projects that you've tried to do and vendors that you interact with. You want to ask many of the same questions. They're just hyper accelerated, right? Each piece needs to be delved into a little bit deeper. The one conversation that I don't feel like people are having yet, which I think they need to be thinking about a little bit more when they're talking about AI, is what their sovereignty picture looks like. What I mean by that is, AI is really, for better or worse, it is going to become a fundamental shift in how you do work and how your business runs. And a lot of these, tiny vendors are coming to you and they're saying, we can solve all these great things. And what they're talking about is they're using these frontier models that you're basically getting into bed with whoever is providing that frontier model, right? So these are the models that are hosted by the big boys like OpenAI and Anthropic, right? And your business is becoming locked into those, which is not terrible in some ways. And we definitely have solutions out there where you can do that with the appropriate security, but be aware of that, because at some point it's going to become really critical to your business to have sovereignty over how you're using AI and what you're doing with AI. It's not exactly, a lot of people try to drive the analogy between what happened with the hyperscalers and people saying, nobody's ever going to trust AWS to do their infrastructure, right? Obviously, that was wrong. People did trust AWS to do their infrastructure. I would argue that AI is going to be a little bit different. It didn't matter so much where your machine was running, because you were going to run a machine where you were, whether it was going to be in the cloud or in your own data center, right? So there were great efficiencies to be gotten by running the machine in a cloud. But with AI, it's going to become an integral part of your business. And so not thinking about the strategy of, okay, when AI is reshaping how my company does things, how am I going to own that and make sure that that I'm not either reliant on somebody else's infrastructure for everything, and I'm also in control of my own destiny, is going to be super important. So I think the conversation needs to shift just a little bit so that people really think about that sovereignty question and how that's going to play out for their company in the future.
Thank you. So as the two of you are engaging stakeholders in healthcare, what's the biggest misconception that you encounter about AI?
Brent, I can start on that one. So I think, a lot of people say, oh, you've got to have an AI strategy. Your AI strategy is really, do I use AI or not? That's the strategic question. And, hopefully the answer is yes and no, we're not going to use it. And, just like you had, Sam, you mentioned, the world of cloud computing, organizations made a strategic decision when cloud computing first came on the market to say, we're going to use it or we're not. And many said not for a long time because they didn't understand or weren't comfortable with the risks. I think AI is sort of in the same place. I'm going to use it or I'm not. And then once you say, yes, AI is going to be part of our technology strategy, then it's just a matter of how I'm going to use it. And then that's less of a strategic question and more of a tactical one. Where does it go? Where does it meet the business need as a tool? And much like, organizations didn't sort of throw everything at the world of cloud computing, they're unlikely to throw everything at the world of AI to get started. And I think just thinking about it sort of in that same way, that it is a tool, and figuring out how they're going to use it to improve their business is really different than saying, oh, I have to have this big AI strategy.
Yeah, I agree with you, Kendra. I think that a lot of people are thinking about it kind of wrong from the point of view of they're like, how do I have this whole strategy? there is, I really don't think that there's a whole lot of question that AI is going to come in and be a part of it, right? Like, so you can kind of get past that, right? The way though AI is going to become part of your business is not something you can predict easily. You can't sit down and say, here's my strategy for how I'm going to apply AI, because you don't know what it's going to be, what it's going to do, right? Tomorrow, somebody in your back office could discover that using AI, they're able to dramatically make their job super more efficient, right? And you don't know where that's going to come from and how that's going to grow out, right? But what you want to do is be there to support that when that happens, but be there to support that responsibly, right? Because you want to have the right security, the right everything around that, so that when it happens, they're not actually broadcasting all your customer data to the internet, because they don't realize that they're using it. So it's a tactical problem, not a strategic problem. It's not how I'm going, as you said, Kendra, it's not how I'm going to like strategically think about how AI is going to shape my business. It's a tactical problem of how am I going to support it as it happens, right? How am I going to allow these organic things to grow responsibly with the security and risk profile that I need to maintain as a healthcare organization?
So we've been talking about, how AI technology has been impacting and influencing strategy, but policy is starting to influence strategy as well. How do you think these emerging kind of federal and state AI policies are influencing AI strategy and product decisions in healthcare? Want to take a shot at that, Kendra?
Sure. AI policy in healthcare is evolving, as healthcare policies frequently do when they're related to technology, especially new technologies. And at the federal level, I think we're seeing the sort of posture not dissimilar to how we're seeing other technology postures, which is very supportive of innovation and understanding risk rather than sort of comprehensive federal oversight, hoping that, private industry can manage innovation and risk appropriately without being overly governed. The federal oversight that is happening is really sort of distributed amongst different agencies. The FDA has a policy around sort of AI-enabled medical devices, and ONC has some policies over health IT. And so you're seeing sort of policies in pockets and special purpose, but not sort of an overarching federal AI policy. On the converse, the states, as they often do in the absence of a strong federal policy, are taking it on their own to adopt AI policies, largely focused on transparency, bias, the incorporation of human review and the human element, particularly in clinical areas where AI is being used. And, that state-by-state approach to AI oversight creates the same kind of challenges that other state-by-state approaches to oversight create, especially in the technology world, as payers who work across state lines, providers who practice in multiple states, large organizations that cover multi-states, and technology vendors that have customers in multiple states have to try and understand all of the different state regulations as they're sort of moving their way through, how that impacts their business, because those state regulations are not the same state to state, and they often conflict with each other. So making that working our way through the state-by-state regulation process, I think, is going to be a multi-year effort for us here.
Yeah, and I think that's, again, where I would say sovereignty is a thing that you want to be talking about and thinking about. These policies are changing daily, right? And they're evolving, and we don't know exactly where they're going to go. And they're often not necessarily completely in line with the technology, right? Because people are trying to make decisions about things which they don't either fully understand or aren't fully understandable, because we don't actually know exactly where it's going. So again, I think companies need to ask themselves this question of, okay, if tomorrow I can't use Model X because of reason, policy Y or governmental regulation, what am I going to do about that? I can't be in a position where my business is just going to stop, right? So asking yourselves how you're going to be in a position to adjust to those policies is going to be more important than trying to like guess what the policy is going to be and position yourself with the right partner. I think that's a discussion which organizations really need to have as they think through tactically how they're going to do this.
Thanks. So when executive teams are evaluating an AI, an investment or technology, what early questions should they be asking specifically to identify any potential red flags or deal breakers before investing significant time and resources? Kendra, any?
Yeah, so, I think that's an interesting question. Red flags. And I think if business leaders focus again at the beginning on, what their business problems are, where do they have delays in their businesses? Where are the big costs? Where's the manual work or poor experiences, or are they underperforming? And they work to see if AI can contribute to the solution to those problems. That's where I would encourage leadership to start, and then understand sort of very situationally sort of what are the important factors there. Are there key important decisions that AI would have to make in that application of AI, and how do they manage the risk of having AI-based decisions, and how do they appropriately include humans, still reap the right benefit, but make sure that there's human and often non-human AI oversight in the work that's being done.
Yeah. I mean, I think what you were getting at, Kendra, which is that the first question has to be, how does this actually impact something that actually impacts my business, right? Is there actually a reason to take on this AI solution? Because far too often you start with the AI solution rather than with the business problem that you need to solve, right? And that ends up in the classic problems that we've had in other software projects where you see a nice shiny thing and you're like, yes, let's go for that. And then you realize that there's really no return on investment. I made that 10 times more efficient, but it was only a fraction of my cost to begin with. And so it doesn't really actually help drive my business, right? So I think understanding those business problems is the first question that you want to ask. And then, Brian, did I interrupt you there?
No, I was just going to say, just expanding on that, as we look ahead in the near term, what developments in AI should healthcare leaders genuinely be paying attention to, and what trends do you think might be getting more hype than they deserve?
Yeah, I mean, I think that's a really interesting thing to figure out how to focus around. I think the hype that is there around generative AI is not just hype. There is something there, right? There is going to be something that generative AI is going to make fundamental evolution in our business. Whether exactly it's going to look like it looks today, that's another thing. I mean, I think that there's a lot of hype around the frontier models and what they can do. I think that probably we're going to see a couple of different things happen. First off, we're going to see smaller models become capable of doing what you need them to do. When you actually figure out what you need them to do, it's not going to necessarily require a frontier model to do that. I also think that there's a lot of room for some new evolution in how these models work. It's quite possible that what we think of as generative AI today is not the end of the road. There's still a breakthrough to be made. So keeping your eye, just keeping a little bit of skepticism about generative AI being the only thing out there. There's still definitely a role for predictive AI, for machine learning, particularly in the healthcare industry, where a lot of the organizations are sitting on some really rich data. If they can figure out how to unlock it effectively, there are a lot of things you can do with predictive AI, and you shouldn't just abandon that because there's this new shiny tool out there. And you need to think about how you're going to use the most effective tool for the most effective thing. Some things don't require AI. not everything is going to be solved with AI. One of the things I think that frustrates me the most is when I find people who are trying to solve what should be solved as a classical computer problem, and they're throwing AI at it because they think, oh, well, AI will solve this, but actually it won't be more efficient. It will burn more tokens. It will do things that you didn't expect it to do. You could have gone through and just solved that with a traditional software system. And AI maybe can help you do that, right? That can be the power of AI, is to help you do that. But don't abandon the possibility that the right solution is just a traditional computer software, run-of-the-mill rules engine.
That was a really great point that some may consider blasphemy, but that AI is not always the right answer to the problem. I think that the thing that excites me the most right now, anyways, about AI and, thinking of it in sort of the near-term time horizon is the agentic AI and the concept of using sort of these teams of agents, much like you'd use a team of human beings to process work and to make things happen, and have, the AI supervisor who's the one that sort of monitors what's happening. And if you think about it that way, and you think about those agents like people and putting together a team of agents to accomplish a function, I think it is really an interesting concept as we think about the work that we do, whether it be, work in sort of any one of the operational or clinical processes in healthcare.
Yeah, just don't forget the human aspect, right? Make sure that you're preparing your people to be successful in that world, right? So they've got a team of agents working for them. All of a sudden, they need a set of skills that they didn't have before. And don't ignore that if you give them those skills, they can do amazing things. But if you just ask them to, basically you're asking line employees to become managers. And we all know that when you want somebody to become a manager, they need a new set of skills. And we need to make sure that we're providing those for people.
Thanks. So we're about to wrap up, but I'm going to ask one additional question to both of you. What is one action or shift in perspective you'd like listeners to take away from this conversation? So as an example, is there an assumption about AI that is no longer true? On the other side, is there an activity often treated as nice to do that should now be viewed as critical? What shifts in perspective would you like to see?
Yeah, I think I've kind of mentioned it already, but I think having that conversation about sovereignty is something which I hope that people will start thinking about as AI becomes really part of your business, as an integral part of your business. How are you going to make sure that you have control, that you have the security that you need, that you have the ability to shift as policy shifts and regulations around the world shift, right? How are you going to be able to do that? I think that that's a really important thing for executives to think about, and think about it with a real understanding that there are some fundamental shifts that are going to happen, and you can't necessarily predict what those are. Nobody can. So preparing yourself is the best thing that you can do. I don't know, Kendra, what's your thoughts there?
Yeah, I think, I think about people who don't spend their daily lives immersed in the world of AI, and they it's not sort of part of their everyday thought process. And I think underestimating how critical AI is becoming and will continue the role that it will play in our lives. I hope people really think about that and understand how really revolutionary it is. And I think about it as being sort of akin to really, the Industrial Revolution. Was that 100 years ago, or how long ago that was? I think AI is going to be, to call it knowledge work, what the Industrial Revolution did to physical work, physical production, and the fundamental change that is going to happen in our country over the next not that many years that AI is bringing to us it's a little bit frightening, but it's also exciting. And I hope that people sort of really start thinking about and understanding how revolutionary this is, and how it will change, our lives and the lives of people in the future going forward.
Thanks. That was a great answer. Well, listen, Kendra, Sam, thank you both for joining me today and helping us cut through some of the noise surrounding AI in healthcare. You shared some very interesting and helpful perspectives. I know they helped me understand this a little bit more. And thanks to all of you for listening. If you enjoyed today's conversation, subscribe wherever you get your podcasts so you don't miss future episodes of The Dish on Health IT. And if you think a colleague would find this discussion helpful, please share it. We're also planning a future webinar to provide a more in-depth kind of AI in healthcare 101. So keep your eye open for that. And if you'd like to be invited, reach out to us. There will be a link in the episode summary. So thank you. Until next time, Health IT is a dish best served hot.
Is it a challenge to stay on top of evolving interoperability regulations and the rapid pace of activity across the HL7 Fire accelerators? Learn more about POCP's Interoperability Outlook subscription service by visiting POCP.com, selecting Regulatory Resource Center, and then choosing Interoperability Outlook.